Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we will be discussing advancements in neuromuscular dentistry and full mouth rejuvenation and how they can help correct jaw problems that can result in painful headaches, teeth grinding, jaw popping, and more that many of us experience and give you the perfect smile that you desire with Northern Virginia's top cosmetic dentist, Dr. Michael Chung. Dr. Chung has created smile makeovers for many models and celebrities, is among only 1% of all dentists in the country who has advanced training in neuromuscular dentistry, is a member of the American Academy of Cosmetic Dentistry, is a graduate of Johns Hopkins University, has received his doctorate of dental surgery from the University of Maryland, and has also received extensive dental training at the world-renowned Las Vegas Institute for Advanced Dental Studies. Welcome back to A New Me. We are here with Northern Virginia's top cosmetic dentist, Dr. Michael Chung. Welcome, Dr. Chung.
Thank you for inviting me back. It's my pleasure.
Oh, it's our pleasure to have you back with us. I know we've got a lot to talk about. We've got before and after patient pictures we're going to be seeing in a few moments. We've got the patient herself who's going to be here as well shortly. But let's start off by letting me ask you if you could please tell us what neuromuscular dentistry and full mouth rejuvenation are.
Okay, neuromuscular dentistry and full mouth rejuvenation is probably the highest form of dentistry one can receive today. Traditional dentistry normally focuses mainly on the teeth and how they bite together. Now neuromuscular dentistry take this to another level, what I call three-dimensional dentistry, where we focus on the joints as well as the muscles and put all these things in harmony so they can have an optimum bite.
So now, neuromuscular dentistry, I believe, also addresses pains like jaw pains, headaches, things along those lines that a lot of people may not realize can be caused by dental-related problems.
Yes, all of those things can be caused by a bad bite. And basically, full mouth rejuvenation is restoring of all the teeth in porcelain so that we can have optimum health as well as optimum aesthetics.
Now, how one would decide between orthodontics, for instance, and full mouth rejuvenation?
Okay, once the bite is established, then the patient can either have orthodontics done to restore their mouth and have their teeth move to the correct bite position, or if they choose to do so, they can have full mouth rejuvenation done. Now, if the person has healthy, ideal teeth, and all they care about is optimum bite, then they can have it moved orthodontically. Now, if the patient has discolorations, chips, or worn down teeth, and they're not happy with the aesthetics, and they have a lot of failing restorations, then these are a perfect candidate to have full mouth rejuvenation done in porcelain.
Now, can you briefly describe a process, or the process, I should say, that a patient would experience if he or she chose either a neuromuscular dentistry procedure or a full mouth rejuvenation? So at least we have an understanding of what's involved, what's entailed.
Well, basically the patient would go through all the scans and the gathering of data using the latest technology. We would find their correct bite position, their jaw position, and find the perfect place where all their muscles would be happy. And then we would put them into a splint therapy called an orthotic. And that could range anywhere from 1 month to 1 year, depending on the severity of their problem. And once all their symptoms have been taken care of, then we can either do orthodontics or full mouth rejuvenation at that point to restore them to health.
So then you would make the decision mutually with the patient on what's the best avenue to take.
Yes.
All right.
Correct.
And I believe you have some before and after pictures of a patient. In fact, her name is Miss Ellen, who we're going to be meeting momentarily.
Yes.
Let's take a look.
Right. Here's a picture of a frontal shot of Miss Ellen to your left here, and we can see from the picture that she has multiple signs and symptoms of a bad bite. We see a lot of recession around the gums, some rotation of teeth, some canting of teeth. She's had some fractures of teeth. Here's an after frontal shot of teeth that are restored to the correct position in porcelain. And here on this side profile shot, you can see one of the teeth has fractured off there, and you can see a lot of the yellowing around the gum lines where gums are receding. And this is the other side where we see darkening and graying of the teeth from a lot of the mercury amalgam restorations and lots of bonding. This is an occlusal shot, view of her upper teeth and her palate. And you can see from here that she has many failing restorations, broken cusps of teeth. This is an after shot of the same view, all the teeth restored in porcelain. This is a before shot of the lower arch, and you can see here as well lots of failing amalgam restorations, and you can see that the teeth are very crowded and crooked and out of alignment. This is the after shot. We were able to create in porcelain and create a perfect arch for her and put everything back the way nature intended it to be.
Talk about a complete smile makeover. Substantial difference with Miss Ellen's within her mouth from really a lot of problems that we could see in the before and after, in the before pictures, excuse me, to what we see in the after pictures. It really was an extreme makeover, so to speak.
Yes. In this case, what we don't see here is that Miss Ellen also had lots of neuromuscular symptoms and pain, and all of those symptoms and pain were all taken care of before we actually restored our mouth to the aesthetic look that we see here.
Now, let me ask you, who's a good candidate for these procedures?
Well, a good candidate would be anybody who has a lot of these TMJ symptoms, you know, busy business executives or anybody who doesn't have a whole lot of time to go to a dentist and fix one tooth at a time. These restorations, as you can see, can be done all at one shot in 2 visits.
We're now going to meet Miss Ellen, who's the patient you just saw the pictures of, and recently she had undergone both the neuromuscular dentistry and full mouth rejuvenation procedures. Welcome, Miss Ellen, to A New Me.
Thank you.
It's great to have you with us. And let me start right off the bat by asking you, what did you have done?
Everything. I had the neuromuscular and then the full mouth restoration.
And what made you decide to get these procedures?
Well, I hadn't decided on the neuromuscular. I just wanted to go in a place, have them slap on new teeth, and have it done. It looked beautiful. And I listened to what Dr. Chung had to say about neuromuscular, and frankly, it sounded a little bit like snake oil medicine. And I thought, so I went back and I did some research on the internet, and it's made sense. And what he said made sense. He really did. I did have headaches. I did have neck aches. And when I started the neuromuscular, and I thought, yeah, right, these are going to go away. And about 3 weeks into it, one of the ladies that I work with there, one of his technicians, said, "How are your headaches and your neck ache?" And I said, "They're gone." Hadn't even noticed. Yes. They were gone. And I don't get the headaches and I don't get the neck aches.
So within a few weeks, right after the procedures, they were gone.
Doing tensing, and he made a device for me that you wear, which is not uncomfortable. You take it out to brush your teeth. It's best if you live with it 24/7. But it's, he said you could eat with it. It's not pretty when you eat with it. So, but you keep it in, and 6 weeks later, you have a new bite.
Well, with the results that you have, obviously, I don't think one mind's going through that inconvenience for a little while.
No, and it wasn't really an inconvenience because his office is just so, they pamper you. So when you go home, it's like, oh, I'm going back. It's wonderful.
I take it you're very happy with the results.
I'm extremely happy, yes.
Do you feel that these procedures, having undergone them, and certainly from what we hear right now and what we saw in the pictures, do you feel it's changed your life in any way?
I could smile. I had got to a point socially and with friends, you know, you're smiling like this because I knew my teeth were shifting, and I went to a dentist who I love very much, but he was a patchwork dentist. It's like refinishing a piece of furniture. If you only do one piece and wait a year and another piece and you look at the total chair, it looks like a patchwork, and that's what I did. And it was time. It was time.
Well, you certainly look great. I can certainly feel that you feel great.
I do. I smile.
Yes, indeed. And on that note, I want to thank you, Miss Ellen, for joining us today on A New Me.
Thank you very much. I appreciate it.
Oh, it was our pleasure.
Thank you.
We're now back with Dr. Chung. She seemed very happy with the results.
Yes, in this case, as you can see, the results were very dramatic. Not only did we get rid of her lifelong debilitating pain and enhance the quality of her life, she also has a beautiful smile now. And a lot of times this will give them a strong boost in self-esteem as well as just a good quality of life.
Talk about the best combination of not only looking better, but feeling better as a result.
Absolutely.
Now, we've only got a few moments left, and I've got to ask you if you have some final thoughts that you'd like to share with us.
Well, you know, like I said, many North Americans suffer from these types of symptoms, and if there's anyone out there seeking this type of dentistry, you have to make sure that you seek an LVI-trained dentist who knows a lot about neuromuscular dentistry.
Well, certainly a very informative interview, as always. I want to thank you, Dr. Chung, for being a guest today on A New Me.
Thank you very much.
Welcome back to A New Me. We provide contact information on our guest experts at the end of this show. For a detailed profile on today's guest, please visit our website at anewme.org. You can also watch all of our A New Me TV shows on our website. Thank you for joining us. See you next week.